Okay, hello. This is my final presentation. I decided to do a PowerPoint on sexually transmitted disease, and the one I chose was chlamydia because I feel like it's something that's it's not really talked about as much, even though how common it is. So I want to go into more detail about that and talk about what we can do about it. So the scientific name for chlamydia is Chlamydia tracheomatis. It is a bacterium, but acts as an infectious virus. It's spread vaginally, uh, anally, and through oral sex. It could spread without ejaculation, so it doesn't have to be. It could be through just contact, physical contact, and that can be through the vagina, the mouth, and then anal sex, and as well. So younger populations are more at risk because of behavioral factors and sometimes biological. But anyone who is sexually active having unprotected sex are more at risk or just as much as at risk despite sexuality, age, and gender. So it doesn't matter how old someone is, if they are having sex with an infected partner, then they are going to get chlamydia. So this is a little bit about the prevalence of chlamydia in the United States. This is taken from 2019, so obviously it could be a little bit different compared to what it is now. What we see here, the biggest thing is the prevalence within younger age groups. So that would be from especially the 20s. It goes down through age, and that probably is because people having less sex with multiple or different partners when they're older. The biggest thing, though, that we see is that the prevalence between men and women are significantly um, are being infected by chlamydia 50% more than men. And that is probably because we'll talk about this soon, but it's probably because the symptoms in women are maybe a little bit more identifiable, or women are maybe getting tested more. But this kind of shows that what we see now in the United States is that women are getting or showing chlamydia more than men. So here's some of the symptoms. I have some pictures as well. So many of those who are infected chlamydia will not show symptoms. Um, but when symptoms do happen, or when they will appear, can be between a few days or 3 or more weeks after being infected. In women, the signs of being infected with chlamydia may include abnormal vaginal discharge, which may be color and smell in the discharge, or burning sensation when urinating. In men, the same goes with the burn when urinating. Also, they may have penis discharge, and sometimes they'll have pain and swelling of the testicles. Um, and the same thing goes since it can be chlamydia can be infected while having anal sex. There can be pain and bleeding in the rectum can be a symptom. And then oral chlamydia can show sore throat and then oral white spots. And you can see the picture right there. That's like an example. The picture on the left is also showing what infected cervix looks like with chlamydia. Fun fact, one time I went to the doctor for sore throat, my tonsils. I was diagnosed with tonsillitis, but my doctor was very insistent. She's like, "Oh, you have oral chlamydia." I'm like, "Oh, I don't think so," but it's just. I look back at it now; it's kind of something kind of funny. But now I'm like thinking, I'm like, "Oh well, she was actually being very considerate of my age group and as a woman, thinking that I had oral chlamydia. Obviously, I didn't, but it was pretty interesting to see that." So treatment: someone who is infected with chlamydia and was able to identify some symptoms or maybe not identify some symptoms, the best way to find chlamydia is through testing. And that could be through a urine test or a pap smear, which is a cotton swab of the vagina, and that is can identify chlamydia. And it's an easy cure. It's just through medication that is prescribed through the doctor. However, the long-term effects of chlamydia that is left untreated is may not be um, treatable at that point. It may not be curable. So we'll talk about that right here, the long-term effects of untreated chlamydia. So in women, the untreated chlamydia can cause PID, which is pelvic inflammatory disease, and that can create some permanent damage. So it can cause long-term pain in the pelvis, infertility. So that's where like the chlamydia spreads to the fallopian tubes and can cause infertility in the uterus and harmful pregnancy. And so that picture right there is showing a difference between a pregnancy, a normal pregnancy, and then a pregnancy from ep- ectopic pregnancy, which is where the egg is outside of the uterus, which is very dangerous and can cause death with the mother or the baby. And that can be caused from chlamydia that's not treated or not never identified. Um, in men, their health problems, long-term health problems, are very rare from chlamydia. If they do happen, it would just cause, not just cause, but like it would cause infertility as well. Um, and yeah, so the biggest thing we learned from this is to get tested and identify which age groups are affected the most. And so they say they recommend that they want women under the age of 25. I think it should be every woman, but they recommend women under the age of 25 should be tested yearly, um, just because they have the worst long-term effects from chlamydia. However, the best way to prevent chlamydia is use protection, communicate with your sexual partner, and get tested. And so, yeah, thank you for listening to my presentation. This is my references where I got my sources from. And yeah, thank you for listening.